Having won 4 International Design Awards, including the Supreme Award in the Australian International Design Awards, Howard Wright's M8 intensive care bed has become a bed of choice for discerning private and public health providers in Australasia. Reflecting Howard Wright's design philosophy of making human care easier, the M8's design team considered everyone who would come in contact with the M8, including the patient, the medical specialists, the orderlies and cleaners. As a bed specifically designed to look after an intensive care patient, what's innovative about the M8 is the incredible range of procedures that can be performed on the bed without the need to transfer the patient. A prime example is its unique radiolucent deck, enabling general X-ray, chest X-ray and even C-arm image intensifier capabilities without shifting the patient. This is achieved due to the M8's twin telescopic columns and asymmetric design, meaning the C-arm image intensifier can be easily positioned around the patient. With its full electric functionality using an intuitive attendant control keypad located on both sides of the bed, the M8 can be reconfigured into a full cardiac chair with sliding backrest and leg raise, into Trendelenburg or reverse Trendelenburg positions, the upper leg or upper body raised, and the overall height of the bed adjusted. There's even a visual 30-degree backrest indicator in the event a patient needs to be positioned to decrease the incidence of pulmonary aspiration. There's also a remote handset at the head end of the bed for patient or caregiver's use. And all keypads can be locked for patient safety using the attendant control keypad. And an onboard rechargeable battery means the M8 can be unplugged, its power cable neatly folded away, and the bed used anywhere without having to be connected to an external power source. And if the patient suddenly goes into cardiac arrest, an emergency CPR function quickly flattens the bed so CPR can be administered. The M8 is simply an orderly's dream bed. Moving and positioning has been made much easier and smoother for the patient with the latest generation of Tenti linear casters. A standard 5th wheel means the bed can be virtually turned around on the spot, ideal for manoeuvrability in confined spaces. Once in place, a central locking braking system can be operated from either side or end of the bed. Even the hygienic storage of linen has been considered, with a pull-out linen rack at the foot end of the bed. And if the patient does need to exit the bed, it can be lowered to a very low height, it's easy to use horizontal side rails lowered, and the back raised to assist the patient getting out of bed. For the caregiver, a full range of accessories can also be provided with the M8, such as IV poles, a monitor tray, and 2 sizes of oxygen bottle holders. And if the head end needs to be removed to access the patient's head, it can be stored at the foot end until needed again. With patient handling and lifting a key issue for medical professionals today, the M8 functionality dramatically reduces the amount of manual handling of patients worldwide. This covers the shortest or smallest patients, up to the largest and tallest patients at 250 kilograms in weight or up to 2.2 metres in height. Before the M8 reaches the medical ward, each bed is hand-built using quality materials and craftsmanship to exacting standards in its own purpose-designed assembly cell. Each bed then goes through a rigorous testing and quality assurance program before being securely packaged for transporting to our clients. Working alongside medical professionals, Howard Wright's design team is focused on designing products to make human care easier, Our products aim to reduce patient handling, maintenance costs, and be intuitive and simple to use. We sum up these design values as simple, smart, and human. Having won 4 prestigious design awards for the M8, we feel the judges' comments say it all.